I'm Dr. Janelle. I wanted to hop on here and talk about something that's really been bugging me. Just really been on my mind about this using antibiotics to treat digestive disorders. The overuse of it. Okay, so think about this. Have you ever heard of someone being treated for traveler's diarrhea with antibiotics? Yes, you probably have, because diarrhea conditions are an irritation, or can be an irritation, from a bacteria that gets in that the body needs to get rid of because it's foreign. And so if you use an antibiotic, that can speed up the removal of that from the body. So that would be an appropriate use of something like rifaximin, which is one of the original uses of rifaximin, traveler's diarrhea. Rifaximin, Xifaxan, same thing. Would you use an antibiotic for traveler's constipation? A lot of people get constipated when they travel. No, you would not do that. So why are we prescribing antibiotics for a positive methane SIBO test when that is said to be a constipation symptom? I honestly can't think of any time where a constipation diagnosis would be an appropriate time to treat with antibiotics. And I just want us to think about that a little bit before going ahead with a treatment that's based on a test, a SIBO test, that has a 30% false negative rate, meaning that if you test positive 30% of the time, that's inaccurate and you don't have that problem. You don't have bacterial overgrowth in the small intestine. And a 40% false negative rate, meaning that if you test negative, you have a 40% chance of actually having the problem, and over a 65% recurrence rate after the treatment with rifaximin or Xifaxan, same thing. The actual treatment that's recommended right now for a methane diagnosis of SIBO, which is the constipation pain, abdominal pain and bloating type of variety of SIBO, is not only a course of rifaximin, but you team that up with something called neomycin, another antibiotic, or metronidazole, another antibiotic. I just disagree with this treatment, and I'm sure that there's other things that we need to look at before pursuing antibiotics for treating this, including the diarrhea type of SIBO, because you can actually stop diarrhea, chronic diarrhea in a patient using antibiotics like Xifaxan. But if the problem really isn't from bacterial overgrowth because the test was a false positive and the problem is really coming from something like a food that your patient is eating or you're eating, then the symptoms will return. So let's be a little more judicious with the application of antibiotics for treating SIBO. The test is not very accurate. I want you to be well.